You know, for a brief period of time in the Detroit community, neutron beam therapy was popular and was promoted as the best way to treat prostate cancer. How is that different than photons that you use, and how is that either risky or perhaps more dangerous to the patient?
So neutrons have what we call a very high relative biological effectiveness, which is great for when they interact with a cancer cell, but not so great when they interact with normal tissue. And there was a lot of enthusiasm with neutrons in the 90s. And there were clinical trials that were done, and they work at curing the cancer, but unfortunately the toxicity rates were unacceptably high, which is why we don't use neutrons anymore. If you guys remember your high school chemistry, neutrons and protons are approximately the same size, the same weight. Protons have a charge and neutrons don't. So with protons, while they carry the same mass and the same energy and will have relatively similar effects upon the tissue that they interact with, protons, you can take advantage of what's called the Bragg peak, which is inherent to a charged particle beam as opposed to a non-charged particle beam, which basically means that's stopping power, and stopping very accurately at a fixed and specified point. Some of the challenges with protons and why the engineering is so complex and why it's so resource intensive, beyond just keeping the machine operating, which is a wonder of engineering, with that extreme sub-millimeter accuracy also comes an increased chance of missing your target. So you have to account for factors, different tissue densities. While you basically assume a water density entirely with an X-ray beam, you have to account for bone and fat and water and muscle and everything else. If the patient has a prosthetic hip, you really can't do good proton therapy. You can't treat through that. So there are a number of considerations and complexities.
So I'm certain you didn't expect to have a night with Mr. Science, but but I thought that if we go down this road, I think it's really a great education to understand the different parts of an atom and how they're used to be charged, energized, and then used as a tool to create radioactive energies by speeding them up and charging them and passing them through your body.